General Harris, it's good to see you here. You've spent 31 years in the U.S. Air Force, and upon your retirement, you have been involved in the private sector, and now you are getting involved in an entrepreneurial activity.
Quite true.
Could you tell us about the National Urgent Care Centers?
Well, I think a lot of people are seeing these kinds of facilities popping up everywhere. They're walk-in clinics or urgent care clinics. These are not the places you go to if you have a bad trauma. You need to go to the emergency room. This clinic that we are building is intended to be one of many. So that, and it will be electronic, so that if people travel the country or if people travel internationally, they can find a National Urgent Care Center and not have their medical records because it's all stored on computers. We don't intend to keep patients. We intend to send patients back to their doctors for follow-up services, so there's nothing to fear from the established medical community for us.
How many staff members will a center generally have?
Each center will have a minimum of 9. It depends on how business grows to see if we will have more in terms of medical care. And these caregivers are going to be doctors. We're not going to have physician assistants or nurse practitioners. We will have nurses, though, as assistants to the doctors. But each center itself, you can count on a minimum of 9. And we look to have approximately 7 to 11 centers right here in Atlanta.
General, would you please describe how you expect these centers to be taken across the country and then even beyond the country's borders?
These centers are designed for urban areas. And just to look at the demographics of where we intend to go, Atlanta, as the first city that we selected, was chosen primarily because it does have quite a few headquarters for Fortune 500 companies. We want to work with their insurance companies. These same companies have businesses in other big urban areas, and we intend to go across the bottom of the United States first and then come back around the top of the United States.
Can you tell us about your personal experience and what role will you play in the expansion of these centers?
I'm the president of the organization and also the chairman of the board. And we are a board of managers, not a board of directors. So we all kind of have an equal say in what happens. So my role will be to make sure that this happens on an equal basis, that as we expand, as we grow, and as we look in different areas, even overseas, that the whole board of managers is brought into play. And my role is from my leadership experience and my leadership background that I've had in the Air Force.
Do you consider your international experience part of that leadership experience?
Absolutely. I was the chairperson for the Women on the Committee on NATO Forces. And this committee had all 13 of the NATO countries involved, with one woman sitting on it. And it looked at how women were treated and how women progressed in the various services. And it's at different speeds and different levels. So it's how you weigh it out for different countries. I would say the Scandinavian countries, Denmark, Norway, are a lot further ahead than the United States in their treatment of women and their fairness of women. Spain, Portugal are a little bit behind. And you don't want to step and get into an international problem by overstepping your bounds and trying to make these countries go a little faster than you want. But my leadership, matter of fact, the NATO chair the general in charge of NATO congratulated me on being probably the first president to really put some oomph into that committee and getting the attention of the leadership.
Could you tell us how you first heard of the Patriot Express program,
well,
the Small Business Administration?
To open our business, we wanted to get a small business loan. And I'm not quite sure which program they started with first, but I know we have ended up with the Patriot Express. Teresa Sexton, who is the bank person that is handling our account, said, let's try this program and see if this can do what Marcelite and the group needs. And sure enough, it did. It's just made for veterans. It has veterans in mind. And this is the time, I think, when we need to pay attention to those young men and women who are coming back from overseas, and especially from overseas in the very volatile areas. Mostly we have people who are in the Guard and the Reserve. So those are part-time people. They have regular jobs. This kind of a loan lends itself to getting them back on their feet again and back started again.